Hello, we are here today with Dr. Marcela Dominguez, our medical director, and we are talking about integrative cancer therapies. So, Marcela, would you tell us a little bit about how you got interested in integrative cancer therapy?
Yes, actually I became interested because as a family medicine doctor, I was doing a lot of integrative wellness medicine, really helping people get well, finding the underlying cause of why they were sick, and then cancer patients started to come my way. And I realized very quickly that I was way outside of my scope of practice as a family medicine doctor, but I wanted to help these people. It was very clear to me that conventional cancer therapy was really not enough for these patients. They would get really aggressive treatment, which sometimes you need to do to get that cancer under control, but a lot of their healthy tissue would be very damaged and compromised, and patients would suffer from side effects. Sometimes they would be permanent side effects, and it would really compromise their quality of life long term. So I went ahead and pursued an integrative cancer therapy fellowship under the American Academy of Anti-Aging and Regenerative Medicine under Dr. Mark Rosenberg. He is kind of my mentor in my fellowship along with other physicians that do integrative cancer therapy. And I did that for 2 years, finished my fellowship in 2013. Since then, I've been helping cancer patients take a more integrative cancer therapy approach. And what that really means is patients can come in with cancer and they can take whatever approach they want. They can do conventional and maybe take a little bit of nutritional support, teach them how to eat better, or they can really go to the comprehensive level where we're starting to integrate nature's pharmacy and nature's therapies to start addressing the cancer and start to really boost up their immune system and dramatically lower their side effects and give them maximum quality of life.
It's amazing. So what types of services do we at Health and Balance provide for integrative cancer therapy?
So any patient who either wants to prevent cancer, of course we want to prevent it. That's the best form of treatment, is to prevent it. So anybody who has a concern in their family history, or maybe they've had their own medical history indicating a concern, some precancerous changes, they had an abnormality on a mammogram, they had an abnormality on their gynecological exam or their prostate exam, and there's a little hint that maybe something isn't going in the right direction. A lot of conventional doctors will just watch and wait and monitor. We like to be proactive and we like to find out why that's happening and try to reverse things. So one thing that is very clear is that cancer is a metabolic condition. We have to take a look metabolically to see if the body is heading in an anaerobic metabolism pathway. In other words, not using oxygen. That's the path towards cancer, and we can actually test for that. If patients already have cancer, they can come and join here and they can meet with us and have a medical consultation, and we can discuss with them their options. And then we partner with them wherever they are. It's not our job to convince them to do something other than what they intuitively feel is right for them, but just to add that integrative component, as I discussed earlier.
Wow. One thing we provide is the high-dose vitamin C IVs. Tell us a little bit about those and why those can be very beneficial.
Yes, so vitamin C has been known to be an antioxidant, which is protecting the body against free radical damage. That's very good. But that only exists at a lower level of vitamin C, something somebody can take orally. But once you want to get into the pro-oxidant effect, in other words, where it can actually start targeting those cancer cells and killing them, you actually need to get the dose higher than what you can actually take orally. I've had a lot of patients tell me, well, I can take a lot orally and I can withstand a lot from a side effect profile, but I explained to them that there is no physiologic ability for you to take enough orally to get what you need to click into the pro-oxidant cancer damaging stage. And that is cancer damaging but yet protective to our immune system. So you need intravenous administration. You need to get the dose up really high and you need to sustain it in order to get those serum levels to that pro-oxidant effect. So there have been many studies demonstrating that IV vitamin C can accomplish that, yet oral vitamin C cannot.
Great. Well, thank you so much for sharing with us, and we look forward to having new patients in. Thank you so much.
Thank you. We look forward to partnering with these patients that can use our help.